morning. I am studying at the University of the Wall of Mexico. I had any class in the Faculty of the Health Sciences Medical Care. The name of my topic is Completed Revision of the Type 2 Diabetes mellitus in the patient with obesity and insulin resistance is for the structure of the case reports. About the presentation is the name of the teacher, the alchemist Alexis Uriel Castillo Hernandez. And any sorry, my name of the student is Miguel Angel Morales Herrera. The grade of the course is 80. For the detailed course is is 0808 English of the clinical practice. In the student AD is 16263667, and my home city is Tabasco, Mexico. And the ratio of the content for my board is the table of content. The page 1, 2, 3 is about to the abstract, and introduction is the 3 page. Methodology is for the 4 page, and the patient description 5 page. And the next is the personal history of the patient included in the 5 page. Physical examination result is in the next page, number 6, and complementary tests is the other page, is the number 7. The treatment plan 7 page, and the expected outcome is also in the 7th page. Actual outcome is 8 page, and discussion. But in conclusion is 11 page and reference 12 page. The next topic is the abstract. We present the case of patient in the one revision was achieved the complementation of the type 2 diabetes mellitus and arterial hypertension through bariatric surgery. This is a young patient with grade 3 obesity and the type 2 diabetes mellitus along evolution with microvascular damage that was subject to a tubular gastroplasty to try to control weight and risk factor associated cardiovascular disease. Prior to surgery, the patient had a large accumulation of the fat in the abdomen which conditioned the great resistance of insulin and made it necessary the use of the sensing drugs along with large requirement insulin with a total weight and 163 glutamate. After the intervention, the patient normalized her body mass index, glycosidic hemoglobin, and blood pressure figures. A year later, still maintained completed remission. About the introduction, the entry is one to decide with the height incidence and the prevalence, and is closely related to the obesity. Currently, around 50 points of the patient with the type 2 diabetes mellitus are obese, a percentage that will increase according to the forecast in the near future. What to the methodology? Since 2000, diabetes mellitus in Mexico is the leading cause of the disease among women and the second among men. In 2010, the disease caused about 83,000 deaths in the country. Is the referring about to the Rodriguez Bolaños, RDLA, Reynal, Shigematsu, and Jimenez Ruiz, GA, Juarez Marquez, is A. Ampersand Hernandez Avila. In 2010, diabetes mellitus increased the rate of the heart disease and the stroke suit a stroke. In addition, in the long term, that can cause blindness due to injury on the blood vessel in the eyes, kidney fallen from damage to kidney tissues, sexual impotence from damage of the nervous system, and amputation from foot injuries. Patient description: 42 years old woman referring the internal medicine consultation in 2019 for diabetes mellitus type 2Y for metabolic control. Then the drugs, then the alcohol, then the smoking cigarettes. And the personal history of the patient included smoking with cumulative substitution of the 55 years, grade 3 obesity, and type 2 diabetes mellitus of 12 years of evolution detected after her second pregnancy, without any present gestational diabetes. Present microvascular lesion expressed such as the mild diabetes retinopathy and grade 1 albuminuria, in addition to grade hypertension 2, hypercholesterolemia, and hypertriglyceridemia. As antibiotic treatment, he combined oral antibiotics, insulin sensitivities at maximum doses, metformin 85 mg over 8 hours, together with the insulin therapy administered in a basal bolus regimen with head insulin requirement, insulin determined 34 unity international in the morning and 54 international units at the night, and insulin reserve 50 unity international for breakfast and 45 international unity for lunch and 50 yen at dinner.
Tres.
About to
Tres.
the physical examination results and vital signs. Reading rate 21 for minutes and body temperature 99.34 Fahrenheit and blood pressure 172 over 19 millimeter of mercury, and heart rate is 80 beats per minute, and cardiac frequency is 97%. In relation with your age is 5.38 inch, and your weight is 282 pounds 90 livers, and the BMI is 47.8, with your perimeter is 4.9093 inch abdominal weight. And complementary test. In the analysis, the hemogram was normal. Profile lipid with total cholesterol of 212 mg over dl with ADL 44 mg over dl and ADL 102 mg over dl, and the triglycerides of 328 mg of dl. About today, albumin creatinine in relation for the condition is rated of 80 mg over gram. The 12 left electrocardiogram was a normal result. About the treatment plan, this patient was referred for the obesity monographic consultation where prospect the option of performing bariatric surgery given on the high vascular rate that the present is a good option for the patient. Initially, the patient say on the start a new program with a hypocaloric diet and physical exercises. But the results were scary. Finally, he to decide intervention after a psychological evaluation turned favorable for mental health. A strict metabolic control program was started to train to get him to surgery in the best possibility condition.
Tres.
About the sped outcome, the patient underwent laparoscopic tubular elastoplasty in November 2020 of the year. In the situation previously educated was a BMI for 103.61 liver inch over 4.65 inch abdominal gear, and the hemoglobin glycosyl is for the 10% total cholesterol 260 mg over delicit. About the blood pressure is for 140 over 89 mg mercury. And a month later, he has lost 46.99 livers. His abdominal grid measures 4.0 130 and had presented several episodes of hypoglycemia. So, there was reduced by insulin dose to use 20 Unity International insulin determinants at dictate more metformin at maximum dose. 5 months after the intervention, the patient had lost one one of 4 livers, had a BMA of 67.90 liver over meter 2. The abdominal gear measured 3.470 ends. Is a large of the condition for the weight of the patient with intervention cured. In analytic hemoglobin glycosylate is 1.52% and blood pressure level had normalized. I note the treatment for diabetes mellitus and hypertension was the complicated, suspended, and maintenance only this simvastatin 20 milligram over deciliter is the actual medication for the patient. Actual outcome initially at the two-stage surgery was considered the field of the which wall consisted the forming and the tubular gastroplasty and the second in a gastric bypass, but given the excellent result of the first intervention, it was not necessary to expand the surgical procedures. It's only on the fear intervention is more adequate for the treatment. About the discussion, obesity is a serious public health problem worldwide, affecting both developed and developing countries. People with BMI less more 30 kilogram or more represent an 7% of the population. Obesity is an independent risk factor of the development of various associated diseases, such as type 2 diabetes mellitus, cystic arterial hypertension, dyslipidemias, metabolic syndrome, hepatitis steatosis, gastroesophageal reflux disease, psoriasis, among other two. New surgical techniques must be considered, but we cannot resort to the discretion of the pathway bariatric surgery by chance, provided to be effective in the treatment of diabetes. Each and every one of the new proposals must present a well-studied psychological principle in animal models, which can then show a fairly on the efficacy profile comparable to existing and well-studied long-term techniques, such as gastric bypass. And about to the conclusion. Bariatric surgery can induce complete remission of the improvement significant and sustainable type 2 diabetes mellitus in the majority of the patients with severe obesity and significant improved comorbidities such as dyslipidemia, hypertension, arterial and sleep apnea, hypopnea syndrome. It's an effort on the early surgical interventions before it's approved irreversible damage to B cell, preferably before 5 years or diagnostic. Increase the chance of the resolution of the diabetes mellitus in the long term. As it's done early, it is believed that apoptosis is stopped and it is stimulated of the replication and the immunogenesis of the B cell. This last also about my case on the speed of reference. The number 1, Rodriguez Bolaños, Ridi at I, Reynald Shigemax, and Jimenez Ruiz. GA, Juarez Marquez, is A, Emerson Hernandez Avila, and 2010. Costo directo de atención médica en pacientes con diabetes. It's okay, it's the final of the topic. Thank you so much.